Good evening. This is Dr. John Bennett broadcasting from Miami. Tonight we have another hangout in a series of Parkinsonism educational hangouts with Dr. Abdul Rana, MD, a neurologist from Toronto, Canada, and a noted Parkinsonism educator. Tonight he has a very interesting topic to me: eye problems and visual problems in Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett.
Okay, I understand. What kind of training did you do? You mentioned before the show in neuro-ophthalmology. That's kind of interesting.
I spent several months in my training with a very good neuro-ophthalmologist. So it was a very good exposure of patients as well as my mentor. So it's really interesting.
What's his name?
He was Mike Rosenberg. He was excellent, super.
Okay. Oh, okay. So he's a noted expert in this field?
Yes.
Okay, very good. Okay. Let me start off with a question. What kind of eye and visual problems do Parkinsonism patients have?
There are many different types of visual problems or problems related to eyes patients with Parkinson's disease have. Now, some of these problems could be related directly to Parkinson's disease. Some could be the consequence of non-motor symptoms of Parkinson's disease, and probably some could be coincidental. This is a very interesting topic, and a lot of research still needs to be done to further understand the relationship of the visual system with Parkinson's disease. So some of the problems which we see in patients with Parkinson's disease, which are related to vision or eyes, they could involve various components of eyes, such as some problems are related to eyelids, other problems could be related to eyebrows, and then some problems probably could be related to extraocular muscles of the eyes, which play an important role in the eye movements, and some issues are due to eyeball itself as well as retina. So most patients, as Parkinson's disease advances, they could notice trouble focusing and depth perception. Lots of patients notice double vision and dry eyes, as well as inflammation of eyelids, such as blepharitis. There is another condition which involves eyelids. It's a dystonia of eyelid muscles, Blepharospasm, and in rare cases, some patients may have apraxia of eyelid opening, and in some instances, the Blepharospasm and apraxia of eyelid opening can occur together in one patient, which is very difficult to treat.
Very good. How does Parkinsonism cause trouble with focusing?
As Parkinson's disease advances, patients notice that they have difficulty focusing when they are reading or paying more concentration to do some work which involves close vision or efforts. They might notice that there is a lot of eye strain or their eye is hazy, and these symptoms do progress as Parkinson's disease progresses. We don't know the exact cause of this. This could be due to a problem with changes in the eye movements, because the extraocular movements, the extraocular muscles of one eyeball, they are coordinated with the other eyeball to make the eye move in a certain direction. So probably there could be a problem with coordination of both sides, the extraocular muscles of one side, which is more affected with Parkinson's disease, with the other side. The exact pathophysiology still is unknown, but it could be a result of neurodegeneration involving dopaminergic neurons. So some of these patients notice that they have trouble moving their eyes together in a certain direction, or they have trouble reading, they have to put more effort in. Still, they have difficulty in reading small text, or their vision is not as good as it was before. And some patients may have the freezing when they make the eye movements. So in the beginning of moving their eyes, like the gate freezing, patients have start hesitation. So probably some patients may have start hesitation of eye movements that could cause a strain on their on their system. Does levodopa help these patients? It's a very difficult question, because these symptoms they usually occur at a stage of Parkinson's disease which is a bit advanced. These symptoms start occurring usually few years after the diagnosis of Parkinson's disease, and by that time, when patients are in stage 3 of Parkinson's disease, the effect of levodopa in any way does become much less. So it's hard to say that levodopa improves these symptoms or would improve these symptoms. Other patients may notice a decrease in the contrast sensitivity, so their vision is not as sharp, or they have trouble with depth perception. So they have some difficulty with the color vision, or a difficulty judging the distance, and this could become a hazard, especially when they are driving. So they have trouble seeing how far is the signal, or when they have to change lanes, or do certain maneuvers while driving. This could cause some problem. These patients should first see their regular ophthalmologist so that they can rule out the other conditions, such as macular degeneration, which is very common in elderly, as well as cataracts or glaucoma, because these are common conditions, and sometimes the symptoms it could be overlapping with these symptoms, and therefore these conditions need to be ruled out first before assuming that these changes are due to Parkinson's disease. As I said before, saying that dopaminergic medication would cause improvement is really difficult, because the depth perception could be related to the neurodegeneration of the dopaminergic neurons, which are present in the retina. So sometimes we do advise patients to have a thorough eye examination when they start having these things or these type of problems, or at times getting 2 pairs of glasses rather than bifocals if they have separate glasses for the distant vision and the near vision, and they can use those glasses when they need to do so, instead of wearing a bifocal which would adjust by itself. I think having 2 separate types of glasses might help them to handle this problem in a better way.
How is double vision related to Parkinsonism?
Double vision again happens in patients who have advanced Parkinson's disease, and it's usually brief. And in most patients, it's usually on a near vision, such as when they are reading, or maybe they're watching TV closely. So usually this happens in off periods. The exact cause is not known. These patients again are somewhat bothered by it, but because it's short lasting, and if this happens in off periods, you may help by adjusting the dose of dopaminergic medications, increasing the frequency of dopaminergic medications, or adding other medications to address the off periods may help double vision, if double vision is occurring only in the off periods. Otherwise, other conditions should rule out, such as a neuromuscular junction problem like myasthenia gravis, or stroke, or diabetic cranial nerve palsies. They could cause double vision in these patients, and there are many causes which are purely ocular causes rather than neurological causes. They should also be ruled out. I think they do benefit from the assessment by an ophthalmologist, and sometimes if the double vision lasts for longer periods, then using an eye patch on one eye could also help these patients.
What causes dry eyes, and what are their complications?
Dry eyes is relatively much more common in Parkinson's disease patients than other problems such as double vision or depth perception or trouble focusing. Dry eyes is likely due to evaporation of the lacrimal fluid, which normally keeps the eyes moist, because these patients have decreased blinking rate. A normal person usually blinks from 12 to 18 times a minute, but these patients may just blink 1 to 2 times a minute, and so which is usually considered with their loss of facial expression. It's very commonly known symptom of Parkinson's disease that these patients have a blank face, so they know they don't blink. So because of not blinking often, so the lacrimal fluid starts drying, and as a result, sometimes patients feel dry eyes or a gritty feeling in their eyes and irritation. This could lead to inflammation of the cornea, and in rare cases it could cause corneal ulcer if this is not taken care of properly. Some patients notice burning or itching in their eyes, so we advise these patients to blink more often or use artificial tears, 1 to 2 drops, 3 times a day in each eye, washing their eyes frequently, or if they are staying in the house mostly, using a humidifier might help, and avoiding any dry or hot room or environment might help these patients, or they can use lubricants sometimes. Taking frequent breaks. If they are reading or watching TV, they should try to take some breaks, and they should close their eyes tightly for some time and then let it go. That would help the lacrimal fluid keep their eye moist, and they should not try to rub their eyes, because this may cause some irritation. And sometimes the dry eyes may lead to other complications such as inflammation of the eyelid. So inflammation of eyelid or blepharitis is seen sometime, and the eyelid may be red and swollen and inflamed. This is a result of decreased blinking, and the eye inflammation causes a lot of swelling. It's very obvious when you see these patients. Sometimes their eyes may become red. Other patients may just have the dry eyebrows. They might have the seborrheic dermatitis, which is common in the eyebrows or ears or in the scalp area. So using some lotions or light warm water or warm compresses may help these patients. Baby shampoos are sometimes helpful, as well as artificial tears or hot compresses if they apply for several minutes twice a day. That may help to make the inflammation go away, and they should not try to use the makeup during the time when they are having the blepharitis. Usually it's a self-limiting condition, but if there is an infection or it becomes inflamed or there's a pus, they should see a physician, because they might need antibiotic ointments or other treatments like this.
Okay, that's a pretty complete survey of eye and visual problems in Parkinsonism. It's subject near and dear to my heart. Anything else before we wrap up with eye and visual problems in Parkinsonism?
Some patients could have other serious conditions due to involvement of the eyelid, such as blepharospasm. The blepharospasm is the dystonia of the orbicularis oculi muscle. The orbicularis oculi muscle is what makes the eyelid, and it surrounds the eyeball, the eye palpebral fissure, and this muscle goes into a spasm. So these patients have the tonic contractions of their eyelids, and their eyelids close involuntarily, and sometimes they have to make an effort to open their eyes. And these symptoms could be seen more often in patients with atypical Parkinsonism, such as progressive supranuclear palsy, but these symptoms do occur in patients with idiopathic Parkinson's disease as well. The blepharospasm could be a condition on its own, but sometimes it's accompanied with Parkinson's disease. It could lead to a functional blindness, because when they look at a glare, or when there's a wind blowing, or there is sun, so they have trouble keeping their eyes open. Sometime in winter, even on a cloudy day, they are wearing these sunglasses. So it could be quite disabling symptom, and unfortunately for this there is no cure. The patients have to use certain treatments such as botulinum toxin injections, and these injections have to be done every 3 months, and they are a lifelong treatment. Like they have to do these injections every 3 months for the rest of the life. And the dopaminergic medications may not help. There are certain medications which may provide some relief, but they are not usually as effective as botulinum toxin. Other patients may have apraxia of lid opening. These patients have trouble opening their eyes when they are commanded, and otherwise spontaneously they might open their eyes. And sometimes apraxia of eyelid opening may occur with a higher frequency in patients with progressive supranuclear palsy or other atypical causes of Parkinsonism. And it is also treated by botulinum toxin injection, but it is more resistant to treatment as compared to blepharospasm. And in some patients, unfortunately, the apraxia of eyelid opening and blepharospasm could coexist. And in these patients, the treatment becomes really difficult, because even if you use higher doses of botulinum toxin, these patients show a very little improvement, and their eyes keep on shutting, and they have to make a lot of effort to open their eyes. And therefore, you may need an ophthalmologist with you, because these patients may need partial myomectomy of the eyelids in addition to botulinum toxin, which may provide some relief.
Do a high percentage of Parkinsonism patients have eye problems, or it's a small percentage?
Usually a medium percentage, like
medium,
a
okay.
third to half of the patients.
Okay.
During the course of disease, they might have one or the other. They may not have all the problems, but some patients, because there are so many problems like double vision, depth perception, trouble concentrating, dry eyes, or blepharitis, or blepharospasm, as I mentioned. So they may not have all of them, but some patients may have some problem during the course of disease at any time, when especially the disease is advancing.
Very good. Thank you very much, Dr. Rana. Another in the series of Parkinsonism Hangout Education, and we'll be continuing tomorrow night with another one. Thank you very much, Dr. Rana.
Thank you, Dr. Bennett.
Good evening.
See you later.